All right, let's jump right in. We're going to tackle a question that, honestly, a lot of leaders are starting to ask themselves as they look towards the future. Are the health benefits we've been offering for decades still the right move? Today, we're going to dig into a pretty big shift in how companies can think about employee healthcare. And this quote right here, it really nails the big idea for today. You can't solve today's problems by just patching up yesterday's solutions. You can't slap a new coat of paint on an old, rickety system and expect it to work for the modern world. You've got to be willing to start with a clean slate.
So, to really get a handle on this, I want to tell you a quick story, a tale of two cities, if you will. Now, stick with me here, because we're going to talk about city planning, but I promise it all comes back to health benefits in a really surprising way. So, picture this. Back in the day, cities were literally built around railroads. The tracks were the arteries of the economy. Housing, jobs, you name it, it all followed the rails. And you know what? For that time, it was brilliant. It made total sense. The whole system just worked. But then, everything changed. The automobile shows up? A total game changer, right? And this is where things get interesting. Did cities redesign everything from the ground up? Nope. For the most part, they just tried to patch the old system. They'd widen a road here, maybe add an overpass there, but they kept the old railroad-centric design. And the result? Well, you can probably guess. Total gridlock, frustration everywhere, and costs just spiraling out of control. And that leads to the million-dollar question, doesn't it? If you were starting from scratch today, would you build your city this way? Of course not. The cities that really took off were the ones that had the guts to ask that exact question. They realized that holding on to an old blueprint just because it's how we've always done it was a recipe for disaster. Okay, so here's the pivot. That whole story about railroad cities, that's exactly what's happening with our health benefits. Our traditional group health plans, they're the railroad cities of the 21st century. They were built for a totally different world, and man, the cracks are really starting to show. I mean, this is the gridlock we're all stuck in, right? Premiums that just keep climbing. That annual renewal panic where you're just crossing your fingers and hoping for the best. And this whole one-size-fits-all idea, it's just broken for a modern workforce that's spread out everywhere. You're basically handcuffed to whatever the carriers decide, riding this roller coaster of costs every single year. So, the big question is, if the old way is a creaky, outdated railroad city, what's the modern, high-speed superhighway look like? Well, that's where something called ICHRA enters the scene. It's basically the answer to that clean slate question. If we were building this from scratch today, what would we do? Okay, let's unpack this alphabet soup. ICHRA. It stands for Individual Coverage Health Reimbursement Arrangement. Whew, that's a mouthful. But the two most important parts are right there in the name. Individual coverage. That means your employee actually gets to pick their own plan from the market. And reimbursement arrangement. That means you, the employer, give them tax-free money to go buy it. See, it's a total flip from the old way. This is the absolute core of it. The model gets completely flipped on its head. The old way is a defined benefit. The company says, here's the plan we picked for you. Hope you like it. But ICHRA, that's a defined contribution. The company says, here's the budget we can afford. Go pick the plan that actually works for you. It's the difference between being handed a company car and being given a car allowance. Huge difference. But here's a really, really important point. An idea this powerful is only as good as its execution. If it's clunky and confusing, nobody's going to be happy. But when you get the administration right, when it's seamless, simple, and people feel like they have help, it stops being just a health benefit and becomes a massive competitive advantage. It's a talent magnet. Okay, great idea, but how do you actually do it? If you're the one in charge of building this new benefit structure, where do you even start? Well, there's a pretty straightforward 5-step playbook for this. Step 1, just wipe the slate clean. Stop trying to put Band-Aids on the old group plan. Step 2, you draw the line. You set a fixed, predictable budget so you're not at the mercy of insane rate hikes. Step 3 is the fun part. You give the power back to your people. Let them choose. Step 4, you get technology to handle all the boring but super important compliance stuff. And the final, crucial step, Step 5, you make it human. You educate, you support, you help people through it. Look, I get it. Any big change feels risky. It's human nature. But let me throw a different idea at you. What if the biggest risk you can take is standing perfectly still? Think of it like this. On one side of the scale, you've got the perceived risk of change. The what ifs. What if ICHRA is too complicated? What if it's not ready?
But on the other side of the scale, you have the hidden, creeping risk of doing nothing, the stuff you're already dealing with, the budget getting blown up every year, your employees getting more and more frustrated with their options, and just the constant administrative drain. So when you really weigh it out, the whole perspective shifts. Modernizing your benefits isn't some crazy, radical move. Honestly, it's overdue. Your workforce is already modern. Your benefits are just playing catch-up. Okay, so if any of this is resonating with you, the natural next question is, where do I start? How do I even begin to see if this makes sense for my company? All right, here are some real concrete steps you can take. First, do that clean slate exercise. Seriously, pretend you have no benefits plan and ask, what would we build? Second, break down your workforce. Does this make more sense for your remote team, your part-timers? Third, kick the tires on compliance. Make sure you understand it. Fourth, find a partner who can make the admin side of this easy. And finally, and this is a big one, plan to over-communicate. Educate your people way before you ever flip a switch. And that brings us right back to where we started. That old blueprint, the one for the railroad city, it served its purpose, but we don't live in that world anymore. Your company's benefits were designed for a different era. So the only real question is, what are you going to build for this one?